Welcome to our video on emergency first aid techniques in the wilderness. When venturing into the great outdoors, accidents and injuries can happen unexpectedly. Being prepared and having a basic understanding of first aid can make a critical difference in a life or death situation. Today, we will explore essential life-saving techniques that can help you provide emergency care in the wilderness. Point 1. Assessing the situation. In any emergency situation, the first step is to assess the situation and the injured person's condition. This initial assessment will help you determine the appropriate course of action and provide timely and effective care. Let's go through the key steps of assessing the situation in the wilderness. First and foremost, ensure your own safety before approaching the injured individual. Assess the surroundings for any potential hazards or ongoing dangers. If necessary, move yourself and the injured person to a safe location away from immediate threats, such as falling rocks or approaching wildfires. Next, assess the person's responsiveness. Approach them calmly and ask if they're okay. Gently tap their shoulder or shake them to check for a response. If the person is unresponsive, it may indicate a serious medical condition or injury.
Check the person's breathing and circulation. Look for any signs of normal or abnormal breathing, such as gasping, choking, or absence of breathing altogether. Feel for a pulse in the neck or wrist to assess circulation. If there is no breathing or pulse, it may indicate cardiac arrest, and immediate cardiopulmonary resuscitation should be initiated. Look for any visible life-threatening conditions, such as severe bleeding or an obstructed airway. If there is severe bleeding, apply direct pressure to the wound using a clean cloth or your hand to control the bleeding. If the airway is obstructed, perform the necessary first aid techniques to clear the airway, such as the Heimlich maneuver or back blows for choking. Lastly, assess the person for signs of shock, such as pale skin, rapid breathing, or weak pulse. Shock can occur as a result of severe injury or trauma and requires immediate attention. Based on your assessment, determine whether the injured person requires immediate medical help or if you can provide on-site care. If the situation is life-threatening or beyond your capabilities, seek help from emergency services as soon as possible. Remember, proper assessment is crucial in order to provide the most appropriate care in a wilderness emergency. Take the time to calmly evaluate the situation, prioritize the individual's needs, and make informed decisions to ensure the best possible outcome.
Point 2. Managing bleeding. Managing bleeding is a critical skill in wilderness first aid, as severe bleeding can quickly become life-threatening. Knowing how to control bleeding can make a significant difference in saving a person's life. Let's explore the key steps in managing bleeding in the wilderness. The first step is to apply direct pressure to the wound. Start by using a clean cloth, gauze pad, or your hand to apply firm pressure directly on the bleeding site. Maintain pressure for several minutes to promote clotting and stop the bleeding. If blood soaks through the cloth, apply additional layers and continue applying pressure. If direct pressure alone is not effective in controlling severe bleeding, consider using a tourniquet. A tourniquet should only be used as a last resort when direct pressure fails, as it can cause damage to tissues. Place the tourniquet approximately 2 to 3 inches above the bleeding site, between the wound and the heart. Use a wide and sturdy material, such as a belt, scarf, or specialized tourniquet, and tighten it until the bleeding stops. Secure the tourniquet in place and note the time it was applied. Inform medical professionals of the tourniquet usage upon their arrival. It's important to remember that tourniquets should only be used in situations where there is severe, life-threatening bleeding that cannot be controlled by other means. Once a tourniquet is applied, it should not be loosened or removed unless directed by medical professionals. After controlling the bleeding, it's essential to monitor the injured person's condition and provide reassurance. Keep them as comfortable as possible and continue to observe for signs of shock, such as pale skin, rapid breathing, or a weak pulse. Seek medical help as soon as possible to ensure further evaluation and treatment. In summary, managing bleeding in the wilderness involves applying direct pressure to the wound and, if necessary, using a tourniquet as a last resort for severe bleeding. Prompt and effective action can help control bleeding and prevent life-threatening consequences. Remember to seek medical help as soon as possible and monitor the person's condition closely.
Point 3. Treating fractures and sprains. Fractures and sprains are common injuries that can occur in the wilderness, and knowing how to provide initial treatment is crucial for minimizing further damage and reducing pain. Let's explore the steps for treating fractures and sprains in the wilderness. If you suspect a fracture, it's essential to immobilize the injured limb to prevent further injury. Begin by assessing the injured area for any obvious deformity, swelling, or intense pain. Carefully support the injured limb in the position you found it, without attempting to realign any bone. Immobilize the limb using a splint. A splint can be created using materials such as sticks, trekking poles, or a folded blanket. Place the splint next to the injured limb providing support along the entire length of the bone. Secure the splint in place using bandages, cloth, or any available material, making sure it's snug but not too tight to restrict circulation. It's important to immobilize both the joints above and below the fracture to provide stability. For sprains, which involve the stretching or tearing of ligaments, the RICE method can be applied. First, encourage the injured person to rest and avoid putting weight on the affected limb. Apply ice or a cold compress to the injured area to reduce swelling. Wrap the sprained joint with an elastic bandage to provide compression. But again, be cautious not to restrict circulation. Finally, elevate the injured limb above heart level to minimize swelling. Remember that the primary goal of initial treatment for fractures and sprains is to immobilize the injured area and reduce pain and further damage. Seek medical help as soon as possible to ensure a proper diagnosis and comprehensive treatment.
Point 4. Dealing with burns. Burns can occur in the wilderness due to campfires, cooking accidents, or contact with hot surfaces. For minor burns, cool the affected area with cool running water for at least 10 minutes. Avoid using ice or very cold water as it can further damage the skin. After cooling the burn, cover it with a clean, non-stick dressing or cloth. For more severe burns or burns affecting a large area, seek medical help immediately. While waiting for medical assistance, elevate the burned area if possible and cover it with a cool, moist cloth to provide relief. In conclusion, having basic knowledge of emergency first aid techniques in the wilderness can be a life-saving skill. Remember to assess the situation, manage bleeding, treat fractures and sprains, and provide appropriate care based on the circumstances. Preparedness, quick thinking, and calmness are vital in responding to emergencies. By being equipped with these essential skills, you can enhance your safety and the well-being of others while enjoying the wonders of the great outdoors. Stay safe and happy adventuring.